Dr. Abha Mahashur, Consultant Pulmonologist at Lilavati Hospital and Research Center, Mumbai. Happy Pneumonia Day to all of us so that we can be preventing the pneumonia or we can be treating it well. On the occasion of Pneumonia Day, we have decided to answer few most frequently asked questions regarding pneumonia. So let us start. What is pneumonia? Pneumonia is infection of one or both of your lungs which leads to damage in the lung. Now this damage can present to us with swelling in the airway, which we as doctors usually refer to as inflammation, or it can lead to filling of your air spaces with fluid, with debris and with mucus. In worse forms, these are the things which lead to drop in your oxygen levels because these are the areas in the lung where gas exchange happens. Pneumonia can happen because of bacteria, viruses or even fungus. Second question, how does pneumonia spread? So pneumonia can spread with droplets which one expels out while coughing or sneezing, and when these droplets are inhaled by other people around, you can get pneumonia. Now there can also be surface transmission. After COVID pandemic, I think we all have been very well aware of these kind of transmissions. But what is surface transmission? So when the person having pneumonia coughs or sneezes and expels out secretion in the air, and these things, they settle down on the surface, and then when a healthy adult or individual comes into that area, touches that area and then touches his own mouth or nose, you can get infection. Now next, what are the symptoms of pneumonia? So high grade fever with extreme fatigability. In extreme cases you can get breathlessness as well, chest pain or abdominal pain while breathing in specifically. You can have cough with mucus in that. You can get a little bit confused state or altered level of alertness, which usually is seen in adults or rather elderly people. In viral pneumonias, you can typically get flu-like symptoms to begin with, which may progress or worsen. Next, how do we distinguish a normal respiratory tract from a pneumonia? So it's very simple. If your doctor told you that you've got flu and he has started you on certain medication, but your symptoms are lingering on for long, think and rule out pneumonia. Then your breathlessness can start, which was not there before. You can get severe chest pain, which was not there before. You can have cough with yellow colored expectoration, which we doctors refer to as pus or purulent secretions. And your general state of well-being can be bad. You can have extreme exhaustion. In all these situations, please rush to your doctor to rule out pneumonia. What are the complications of pneumonia? So the complications can be divided into two broad headings. You can either get local complications like within the lung. So if you've got a very bad form of infection, you can have breathing difficulty, which can warrant either an oxygen support system or a breathing support system, which we usually refer to as ventilatory support. Second, you can get pus and a cavity. So whenever your pneumonia gets too very aggressive, despite giving the treatment, you can get cavitations or round hollow spaces in the lung where you can have pooling of secretions, typically pus. This is what is known as lung abscess. Thirdly, you can have exudation or leaking of fluid outside the lung. So our lungs are covered by membranes called as pleura. So you can get collection outside the lung, which may hamper your breathing in a comfortable zone. And then you have distant complications or extra pulmonary complications. So the bacteria or the germ which has led to pneumonia in your system can actually leak to the bloodstream and can cause bad form of infection because these toxins start getting circulated in the body and can get other organs also involved. This is known as bacteremia or sepsis, or can lead to multi-organ dysfunction. Who are the people who are at risk to get pneumonia? So first and foremost, extremes of age. So an individual who's more than 65 years of age has poorer immune system, so he may not be able to get back to the normal health with a normal simple infection, so can progress to pneumonia. Then children less than 2 years of age, because the immune system is yet not formed in a good robust way, so they are more susceptible to progress to pneumonia. Secondly, people who have chronic pulmonary diseases like asthma, cystic fibrosis, chronic obstructive pulmonary diseases, fibrosis in the lung, they are all more prone to get pneumonias. Thirdly, weakened immune system. So people who have issues like cancer or who have HIV and AIDS, these are the people who are inherently more susceptible because of the weak system there. Or if you are on certain drugs like chemotherapy, which can reduce the immunity, or long-term steroids, which have to be defined by your doctor, not by you or not by Google, then you are more predisposed to get pneumonia. Uncontrolled diabetes, again, one of the forms where we can have more pneumonias in these patients, so it's important to control your diabetes. Fourthly, people who have poor swallowing reflex because of a neurological problem like Parkinson's or stroke, they are more prone to get pneumonias. Then, someone who smokes quite a bit or takes alcohol on regular basis, they have poorer local immunity and then again can cause pneumonias in the system, which can quickly progress from a simple respiratory tract infection. People who are working into areas where you have an occupational exposure of toxic fumes or noxious particles, they again get poorer local immunity in the lung and can quickly progress to pneumonia. Analysis of the patient or examination of the patient like inspection, palpation, percussion and auscultation. If any of such findings are there, we should suspect pneumonia and get a chest X-ray done. So chest X-ray can confirm the diagnosis of pneumonia, where we can tell you that what are the chances of you to get either treated in the hospital or at home, so everything gets clearer. To assess the severity of pneumonia, you can also check your pulse oximeter levels, your oxygen levels in the blood, which can again help us to assess where the treatment can be. We can do a sputum examination to understand what is the cause of your pneumonia. Last but not the least is prevention of pneumonia. So can we prevent pneumonia? Answer is yes. Now, because of COVID, or rather I should say thanks to the pandemic, that we know that vaccines help. We need to understand very clearly that vaccines can prevent infection or no. Answer is that understanding the importance of vaccine is very, very significant. So a vaccine can reduce the chances of getting a severe infection. It may not reduce the chances of getting an infection. So if I take vaccine, I will be subjected to infection, yes, but I may not go towards a worse form of infection. I may not get complication with the infections. So the most commonly used and the most important vaccines to prevent pneumonia are two. One is pneumococcal vaccine and second is influenza vaccine, commonly known as influenza shot or flu shot. Now, pneumococcal vaccines are very important because pneumococcal bacteria are the most common cause of getting pneumonia in one. Who are the people who are at maximum risk? Again, extremes of ages like someone who's more than 65 or children who are less than 2 years, people who have chronic medical ailments, chronic lung diseases, immunocompromised host, where your body is suffering from less immunity or compromised immunity because of any reason, and thirdly, people who are smokers. Even those who are getting subjected to second-hand smoke, which means that you don't smoke, but people around you are perpetually smoking and you are inhaling the same toxic fumes. All these people are more prone to get pneumococcal diseases. There are two types of pneumococcal vaccine. One is pneumococcal conjugate vaccine, which is PCV13, PCV15 and PCV20. And then second is polysaccharide vaccines, which are 23 valent. So you need to contact your doctor to understand which vaccine you can take, when to take, and how to arrange these two vaccines in certain patients, because we can do that one after the other. Second is influenza shot. We all know about flu shots. Every year, influenza shots are extremely important for people who have chronic lung problems, for healthcare workers, for pregnant ladies, and whosoever is prone to getting frequent infections, which again should be dictated by the doctor, not Google. Now, what more can we do to prevent pneumonia? Wash your hands regularly. Like I told you, you can get the infection through surface contamination, through even being around people who have pneumonia. So a simple thing of washing hands really helps us. Thirdly, quit smoking and avoid being exposed to smoke around you. Helps a lot. And last, take care of immune system. If you keep your immunity strong, you don't have to worry with pneumonia. Thank you.